Have you ever considered the importance of water filtration in dental practices? It might not be the first thing that springs to mind when you think about dental care, but it plays a vital role in maintaining a safe and hygienic environment. Dental units are complex pieces of equipment. They utilize hydraulic systems to distribute water to various points within the unit. This includes the patient's glass, water bottle tanks, ultrasonic scalers, high-speed drills, and air and water syringes. To mitigate the risk of contamination, handpieces are equipped with anti-retraction valves. But despite these precautions, there's always a potential risk of contamination and cross-infections. Now let's talk about Coxsackie virus B5. It's a non-enveloped RNA virus, which means it's resistant in water environments and can pose a threat to human health. You might be wondering, why are we talking about a virus in a discussion about dental practices? Well, this virus helps us understand the risk of cross-infection during dental procedures. Imagine a scenario where a patient with Coxsackie virus B5 receives dental treatment. The virus might get into the water system of the dental unit. Now, if the water isn't adequately filtered before it's used on the next patient, there's a chance that the virus could spread. This is just one example of how cross-infections can happen in a dental setting. This brings us to the need for disinfection protocols and efficient filtration systems in dental practices. These systems act as a barrier, filtering out harmful microorganisms and ensuring the water used in dental units is clean and safe. In other words, they're a crucial line of defense against potential threats to our health. Of course, water filtration is just one aspect of maintaining a safe dental practice, but its importance cannot be overstated. It's a proactive measure that helps protect both the patients and the dental professionals from potential health risks. So the next time you sit in a dental chair, you might want to spare a thought for the unsung heroes of dental hygiene, the water filtration systems. So, how did we conduct the study to assess the efficiency of water filters, you might ask? Well, let's dive right into it. Our research was rooted in the use of 18 ultrafiltration filters, each characterized by a unique nanoreticular structure and activated vegetable carbon. These filters are not your everyday kitchen water filters. They are high-tech specialized devices designed to block even the tiniest of unwanted particles. The star of our study was the filter, a top-tier tool in the water filtration industry. This filter is equipped with a 0.05 micrometer nanopore physical barrier, a feature that makes it quite the formidable opponent against water contaminants. We strategically positioned this filter for incoming water upstream of the dental unit. In other words, before the water reached any part of the dental chair unit, it had to pass through the filter. Our testing process was conducted at the Department of Medical, Oral, and Biotechnological Sciences of the University of Chieti-Pescara. We began by contaminating sterile distilled water with known viral titers of Coxsackie virus B5. This virus, being non-enveloped and resistant in water environments, poses a significant threat to human health. After the contamination phase, we collected samples of the filtered water. We then carried out an in-depth analysis of these samples to determine the residual viral load. This step was crucial in understanding the extent to which the koala-registered trademark filter was able to reduce the presence of Coxsackie virus B5 in the water. With this methodology, we aim to evaluate the filter's efficacy against Coxsackie virus B5. In the forthcoming scenes, we'll delve into the results of this research effort. Stay tuned to learn more about our exciting findings and their implications for the world of dental practices. Now, let's look at what we found through the study. The statistical analysis of our study involved robust methods like the Shapiro-Wilk and T-student tests. We also used a power analysis to determine the number of filters required to attain statistical significance. As per scientific conventions, we considered results to be statistically significant when we had a p-value less than or equal to 0.05. So, what did we find? Well, the results were quite remarkable. The filters we tested demonstrated an astounding 99.9999% reduction in viral load. This impressive figure held true even when we started with high initial concentrations of the virus in our test samples. The magnitude of this reduction is hard to overstate. Essentially, the ultrafiltration system reduced the Coxsackie virus B5 to near non-existence. But that's not all. We also observed a significant difference in the levels of viral contamination in the water before and after filtration. This wasn't just a minor change, it was a drastic reduction. The difference was so significant, in fact, that our p-value came out to be 0.000000. In the world of statistics, that's a powerful testament to the effectiveness of the filtration system. Put simply, the ultrafiltration system was able to nearly eliminate the presence of Coxsackie virus B5 from the water. This virus, known for its resistance in water environments, was no match for the filtering capabilities of the system. These findings aren't just numbers on a page. They represent a major step forward in safeguarding the health and safety of both patients and dental professionals. By drastically reducing the presence of potentially harmful viruses, we can help prevent cross-contamination and infection in dental practices. To sum it up, our study provides solid evidence of the ultrafiltration system's effectiveness against Coxsackie virus B5. These findings, backed by rigorous statistical analysis, highlight the immense potential of this system in maintaining a clean, safe, and hygienic dental practice. These results validate the effectiveness of the ultrafiltration system against Coxsackie virus B5. So, what does this all mean for dental practices? Well, it's quite simple. The study validates the effectiveness of the ultrafiltration system against Coxsackie virus B5. This not only helps to keep the water supply clean, but it also indicates a high potential for the system to safeguard against larger microorganisms, such as Legionella. This is crucial because maintaining microbiological water quality in dental units is paramount for the safety of both patients and personnel. Moreover, the ultrafiltration system has shown an impressive ability to completely eliminate viral charges. This significantly reduces the risk of cross-contamination, creating a safer and cleaner work environment. Safety and cleanliness are always top priorities in any dental practice, and this study provides a promising avenue to achieve just that. In conclusion, the study underscores the significance of water filtration systems in ensuring a hygienic and secure dental practice.